Hi everyone, so this is my presentation comparing bipolar and borderline personality disorder, finding the line where one disorder ends and the other begins. In this presentation, I will be discussing what the difference is between bipolar disorder and borderline personality disorder, why it matters, going over a little bit of previous research and my proposed potential research project and the conclusion. First, I'm going to discuss bipolar disorder. It consists of depressive episodes and manic episodes and a fluctuation between the two of those. Bipolar disorder consists of depressive episodes in which a person experiences 5 or more of the following symptoms within a 2-week span. Anhedonia, or the loss of interest in activities you once enjoyed. Depressed mood most of the day, nearly every day. Weight loss, sometimes weight gain, decrease in appetite, sometimes increase in appetite. Feelings of worthlessness, inability to concentrate, and recurrent thoughts of death. Recurrent suicidal ideation without a specific plan, or suicide attempt. So 5 or more of those constitutes as major depressive disorder episode. So that's 1/2 of bipolar, and the other half would be a manic or hypomanic episode. Those diagnosed with bipolar have also experienced at least one manic episode, which lasts for at least a week and is present every day for most of the day, or a hypomanic episode, which lasts for at least 4 consecutive days for most of the day. During this period, 3 or more of the following symptoms must be present and must be a drastic change from the usual behavior of the person. So if they are always talkative and antsy and have a lot of energy, this wouldn't constitute as a manic episode for them. That's just their normal behavior. If it is a manic episode, it may include inflated self-esteem or delusions of grandeur. A good example of that is Kanye West. If you're familiar with him and his outbursts that he's had in the past, he claims that it was due to mania from bipolar. Elevated energy with less need for sleep, extreme talkativeness, pressured speech, racing thoughts, distractibility, increase in goal-directed activity, and impulsively, this is the important word in all of this, impulsively engaging in activities that hold the potential for negative consequences, such as spending sprees, unsafe sexual encounters, reckless driving, and drug and alcohol abuse. Borderline personality disorder is defined by the DSM, or the Diagnostic Statistical Manual of Mental Disorders. We're on the 5th edition now. Defines borderline personality disorder as a pervasive pattern of instability of interpersonal relationships, self-image and effects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. So 5 or more of the following symptoms leads to a borderline diagnosis. So frantic efforts to avoid abandonment, real or perceived, a pattern of intense and unstable relationships, unstable self-image or sense of self. Really important part is the impulsivity in at least 2 areas that are potentially self-damaging, including spending sprees, sex, substance abuse, reckless driving, binge eating, etc. So that overlaps with bipolar disorder as well. Recurrent suicidal ideation, threats, behaviors, in this case self-mutilation, that overlaps with bipolar. Affective instability with borderline usually only lasts for a few hours, rarely a few days. Affective instability is essentially a mood swing. Yeah, they're a lot shorter for borderline than with bipolar. Persistent feelings of emptiness, intense and inappropriate anger, difficulty controlling anger, and recurrent physical fights can also be seen in bipolar, but it's different causes. And transient stress-related paranoia, severe dissociative symptoms. So the similarities and distinctions between the two. Both disorders share symptoms of impulsivity, suicidal ideation attempts, hostility, agitation, angry outbursts, and affective instability to an extent. Affective instability is the repeated, rapid, and abrupt change in mood that is hallmark of borderline, which can be confused with mood swings occurring with bipolar, although the duration of the episodes for the two disorders is distinct in contrast. So, as I mentioned before, the mood swings with bipolar disorder occur less frequently, but they last longer than with borderline. Borderline, they are more frequent and they do not last as long. A person with bipolar experiencing mania may become suddenly agitated and angry, possibly become hostile and violent, which may also occur as a symptom of borderline personality disorder. Differences in displays of impulsivity may help further clarify and differentiate the two disorders. So I just said a bunch of words, but now I'm going to explain why they all matter. So bipolar disorder and borderline have a few similar symptoms that may cause misdiagnosis and therefore the possibility for less effective treatment. Determining what the differences in impulsivity look like for each disorder may allow for more accurate diagnostic and screening procedures. Lives can potentially be saved from suicide and other drastic actions that may occur as a result of said impulsivity, suicidal ideation, and agitation associated with both disorders if they are not treated appropriately. Previous research shows that the occurrence of bipolar and borderline personality disorders comorbidity is significant. So about 20% of people diagnosed with either of those experiences the other as well. Comorbidity is simply the coexistence of two different disorders. Previous research has also shown that patients with borderline personality disorder were significantly more likely to have been previously misdiagnosed with bipolar. Past studies conducted ecological momentary assessments of impulsivity, or EMAs, in which mood and impulsivity levels were measured in the participants' natural environment with a self-report survey. In this same study, participants with borderline or depressive disorder filled out an electronic diary for 28 days and responded to 4 impulsivity items up to 6 times per day, and were assessed using the momentary impulsivity measure. I'm going to be essentially replicating that study, but using an app on a phone and correspondence via email rather than a device that was given out to the people in this study. Okay, so first research question is how common is the comorbidity of borderline and bipolar in the sample that I will be surveying? My hypothesis is at least 20% of those afflicted with one of the disorders will meet the criteria for another. So in line with previous research, at least 20% of those. Second research question is which, if any, specific impulsivity measure will stand out as more prevalent in borderline or bipolar, and which measures will be significant for both. So there are 4 different items that will be rated throughout the day, and they are: I said things without thinking, I spent more money than I meant to, which I think will occur more often with bipolar disorder, and the other 2 are I have felt impatient and I made a spur-of-the-moment decision, will occur more often with borderline personality disorder. So participants will be selected from CSI psychology majors contacted via CSI email. I think if you just reach out to the department head, they can send out these emails for research for school. Ideally, there will be at least 100 participants, but more are welcome, obviously, to increase validity and reliability. Subjects must be 18 years old and up, in generally good physical and mental health. All races and ethnicities are welcome. All information collected will remain completely anonymous to the public, so no names will be used in any way, no birthdays, no addresses, nothing of that nature. No personally identifiable information will be used in any way. Subjects will be informed that some of the questions pertain to suicide and unpleasant feelings in subject matter and may cause distress when they are recalling them. Subjects will be reminded that participation is voluntary and that they may leave the study if they feel uncomfortable. Subjects will be provided with contact information for the CSI Counseling Center if additional support is needed. Procedure and data analysis. So the recruitment email will have a link to a web page with the following 2 brief surveys that should take about 5 minutes or less to complete. They're very short. The mood disorder questionnaire, which screens for mood disorders such as bipolar disorder, and the McLean screening instrument for borderline personality disorder. These surveys perform very superficial and preliminary screenings for bipolar and borderline. The results will be explained after completion, and the subject will be reminded that this does not replace a doctor's diagnosis, and this is just for undergrad research project purposes. This is not a formal diagnosis, and I am not a doctor. I'm not claiming to diagnose you with anything. Just looking for surface level criteria, symptoms and criteria. The results will then be sent to the researcher's email, me, and a follow-up email with instructions as to how to download the Mood and Impulsivity Diary app will be sent to the participants. So the app will be created by me, and then I will provide the participants with instructions as to how to download that and how to operate it. The participant will complete the 4-item diary several times per week, several times a day also, receiving a notification when an entry is required. The diary entries will be filled out for 8 weeks and then measured using the momentary impulsivity measure, which is from a previous study that I am replicating. The resulting data that I collect from all of these surveys will be put into the computer using ANOVAs to determine the relationship between borderline and bipolar and impulsivity, and bivariate correlations will be run to determine the strength of those relationships. As with any study with humans, there is a risk-benefit ratio. The subjects may experience mild to moderate distress when recalling personal information, but additional support will be available should the subject feel uncomfortable during or after participation in the study. Participation is completely voluntary and can be recalled at any time. Subjects will be committing to about 5 to 10 minutes of diary completion a week for 8 weeks. So it's really very, very brief. People probably check their email or, social media more often than spend more time doing that than this would require of them. The benefits outweigh the risks if we can consider and understand how to identify characteristics of borderline and bipolar and treat them appropriately, preventing families and friends from losing loved ones to suicide due to a possible misdiagnosed mental illness. The financial burden of mental illness-related hospitalizations could also be lessened with early intervention and care, putting less stress on society as a whole. The conclusion for this support for this project may provide more valuable information for clinicians to distinguish borderline personality disorder and bipolar disorder and apply the appropriate treatments. Medication seems to work slightly better with bipolar than it does with borderline. The more we know about the subtle differences that exist within certain diagnostic criteria, the more accurate the diagnoses will be, and society can ultimately benefit as a whole from properly treated mental illness, suicide prevention, and less psychiatric hospital admissions.